Hi everyone, good Friday morning and welcome to Smart Health on GoLocal Live. I'm GoLocal News Editor Kate Nagel. I'd like to welcome in my guest for this special showing, Dr. Don Dizon from the school, the professor of oncology that is here. It is Ovarian Cancer Awareness Month,
Right.
and so no better expert than to have with us here downtown. But first of all, let's introduce you to viewers about your
Sure.
work with at the school and at the partnering hospitals as well. So tell folks a little bit about yourself.
Right. So I'm originally from Guam, but have been on the East Coast for my entire career. I came to Brown after my fellowship at Sloan Kettering in 2003, and I was in faculty at Women and Infants Hospital in the program in women's oncology for a long time. Then transitioned to the Mass General Hospital before being recruited back to Rhode Island Hospital as the director for women's cancers. And the founder and director of the Oncology Sexual Health First Responders Clinic at Rhode Island Hospital.
Well, glad that we could lure you back to Rhode Island, away from the big behemoths up north.
Yeah.
And because it is Ovarian Cancer Awareness Month, we'll go in a little bit more about your work at the hospitals. But from the broad sense and the numbers, 1 in 78, I believe, women will be exposed, experience ovarian cancer. Let's talk a little bit about the awareness around it. Obviously, regular checkups for women, but symptoms and the importance of early detection.
Right. The problem with ovarian cancer today is that the ovaries are so deep in the pelvis of a woman that until the disease leaves the ovaries, women are really unaware that they have the disease. So one of the things we always say is to learn your family history, because that can be the biggest cue if you're going to be at risk of developing either ovarian cancer or even breast cancer and a whole host of others. But for women who experience very non-specific kind of complaints, especially if they last a long time, so pain, lower pelvis, some bloating, your pants not fitting as they usually did, changes in appetite, or early feelings of fullness and even some nausea and vomiting from things that normally don't bother you, changes in bowel habits. These are the signs of ovarian cancer, but if you think about it, it's probably signs that you've had before. The key there is that they persist and sometimes even worsen.
And so when you talk with your doctor, walk us through those stages, walk us through the tests. Let's start with that first. I mean, what does that look like to the patient who then goes in, gets tested, and then goes from there?
Right. Typically what's going to happen is a patient will make multiple trips to their primary care doctors with complaints of bloating and very nonspecific complaints. That will ultimately lead to a CAT scan. And a CAT scan will show issues in the ovaries, maybe a mass of the ovary, maybe some disease radiographically seen involving the abdomen. That will prompt blood work. And specifically, there's a marker in the blood that we follow if we're thinking ovarian cancer or we're worried about it, and it's called CA-125. If that's elevated and the CT scan looks concerning, then they're going to see one of my surgical colleagues in gynecologic oncology. And today, the first question that any surgeon will ask is, does this look like ovarian cancer? And can I get it all out? And that's the crucial algorithmic point. If someone can go through surgery and the surgeon is pretty confident they can remove all the disease, then that woman should undergo surgery first. If there's any suggestion that they cannot get all the disease out, and sometimes you'll hear surgeons say it's an R0 resection, then they'll come see me, and we'll talk about the role of chemotherapy before we do the surgery.
And let's talk about then survivorship. Obviously, going through the treatment, living with cancer, and then life after cancer. Talk with us about how in your field you really came to the forefront as being sort of an expert in this and the need to address it within the field. So, take us through that timeline.
What's so interesting about survivorship in oncology is that there was this very important report that the National Institutes of Health put out, and it was called Boston Transition, and it really was about patients being treated for cancer, being cancer-free, and then no one assuming responsibility of their aftercare. Who's going to give them a flu shot? Who's going to refer them up for a colonoscopy so they don't get another kind of cancer? What was lost in that discussion is a whole notion that there's some people who face a high risk that the cancer is going to come back or never stop treatment. And unfortunately, women with ovarian cancer, their risk of that cancer returning, if you're diagnosed with anything other than the earliest stage of disease, are as high as 80%. So I came to this field of survivorship understanding that you're a survivor once that diagnosis is made. And because of that kind of perspective, I include women who are dealing with ovarian cancer, and I hope to have themselves identify as survivors even if the cancer comes back. And I think that's a really important point that I think we're now starting to embrace. But we did this very interesting survey on Twitter, and we asked women on social media where they see survivorship, how they see themselves in survivorship. Is it a relevant concept after a diagnosis of ovarian cancer? And we found women navigate post-treatment on their own, that there aren't that resource for women with ovarian cancer, but they really want that. And they want it to be relevant even after the disease comes back. So again, this point that survivorship is at the point of diagnosis, and these concerns stretch out whether or not you have disease.
And you also look at it from an interesting vantage point of the whole person, the whole lifestyle, sexual health.
Yeah.
You know, having gone through something, very of such a great magnitude, and as you said, addressing, the health of the body, but then there's the whole person. So talk with us a little bit about that. You've treated the cancer, but then the person is just trying to live their life.
Right, and there's even something more to that. It's the idea that cancer is a social disease. That, the partner, whether it's a man or a woman, whether it's kids or best friend, they're witnessing a traumatic event that they are not able to help. They can't take the chemo for you. They can't do the surgery for you. They can't take away the side effects for you. So this experience of watching someone you love go through cancer can be as traumatic as it is for the person undergoing that treatment. And in that context, we can look at sexual health as a concept that can bring people together, but if unaddressed, can really create a barrier. So I think one of the things that sexual health is emblematic for in survivorship is this idea that you need to not only talk to the woman, you need to talk to her partner, you might even need to talk to her family, so that everyone understands that, cancer is not a one-time course, that even when that treatment stops, that woman doesn't ever leave cancer land, even as everyone around her wants to. And in terms of sexual health, it's always important, I do this now, I try to meet with the couple, figure out a starting point where we all can agree this is where we want to start, make some goals for now, for 6 months from now, and in the long term, so that they can work on things and recovery as a couple.
So tell us a little bit about what's taking place at the Warren Alpert Medical School right now. Here we are, September. The students are back. You do work closely. So what's going on campus, Doctor?
Yeah. There's quite a bit of activity, both at Women and Infants as well as Rhode Island Hospital, where both institutions have incredible women's cancers programs. And I'm very fortunate because I think of us as a very tight-knit community, and there's lots of collaboration that's ongoing, particularly with the leadership at the medical school. Right now, Dr. Wafik El-Diri, who's the Dean for Oncology Sciences, has convened these translational research disease groups, where it's anyone interested in ovarian cancer we meet. And it's an open forum, so students and other faculty from the university and the med school and the hospitals can come in and not only learn about some of the activities that we're doing, but provides the opportunity to discuss new projects, new directions. And in that vein, we're doing several clinical trials. In fact, one of our trials we're doing here is looking at one of the rarest types of ovarian cancer, called clear cell cancer.
Okay.
And we're looking at 2 kinds of immunotherapeutic treatments for that to see if we can make the immune system stronger by using either one drug or two drugs as a way to treat clear cell. We were the only site in the country running this trial, and we've treated people as far as Canada and the Midwest, and I get referrals all the time from colleagues in Boston around that. We're also doing work with couples, trying to see if we can improve intimacy after the cancer experience, and we're looking at caregivers and seeing if there's a way we can address the needs that are specific to the person who has been supporting you while we're getting you through the cancer experience itself.
So you speak to Rhode Island, being at the forefront of that particular research, and you kind of alluded to it. What does that speak to the school and the partnering hospitals? I mean, the level of excellence here and the research that's being done. I mean, let viewers know a little bit about that. I mean, we've had others from Brown here as well, but really at the forefront of trying to, make some breakthroughs in cancer research. But having been tapped to do the trials, I mean, it's a clear indication that this is, one of the places to be for ovarian cancer research.
Right, and I think that's very true. I think for gynecologic cancer, my colleagues from Women and Infants certainly have positions of leadership in the national cooperative groups, where a lot of our clinical trials that are funded by the National Cancer Institute get done. Paul DiSilvestro, who's head of the program Women's Oncology, is a leader in what's called the NRG Oncology Group, and his faculty have been on papers in the New England Journal of Medicine, where we published results on a new class of drugs that has really changed the disease tempo for women with a genetic mutation associated with ovarian cancer due to BRCA gene mutations. Beyond just Paul, I'm represented in the SWOG at Cancer Research Network, another NCI-sponsored group, where I'm leaving actually next week for the semi-annual meeting in Chicago. The leadership that's present in the university level with Michelle Dawson, who's a colleague of ours and a very good bench researcher, helps sort of fill out what we can do here. So I think we have an incredible foundation in women's cancers here in Providence, and I only see that growing.
Well, I appreciate your taking the time to come in today to let folks know what's taking place again at the Warren Alpert Medical School at Brown, as well as partnering hospitals here. So Dr. Don Dizon, thank you so much for taking the time to watch.
Thank you for having me. It was wonderful to be here.
And thank you for tuning in on an early Friday morning here as we kick off your almost start to the weekend in downtown Providence on live. We appreciate your watching. We'll be back soon with more here at GoLocal. We look forward to seeing you. I'm GoLocal News Editor Kate Nagel.